Understanding chemotherapy, definition, mechanisms, and success rates. Chemotherapy is a cornerstone of cancer treatment, encompassing a range of drugs designed to target and kill cancer cells. Its role in oncology is crucial, but it is also complex, with a wide array of factors influencing its success. This article aims to provide a comprehensive overview of chemotherapy, including how it works, its types, side effects, and success rates. What is chemotherapy? Chemotherapy refers to the use of chemical substances to treat cancer. The term originally derived from chemo meaning chemical and therapy meaning treatment. While often associated with cancer, chemotherapy can also be used to treat other conditions such as autoimmune diseases and infections. Chemotherapy drugs work by targeting and killing rapidly dividing cells, which is a hallmark of cancer cells. However, because these drugs are not exclusively selective for cancer cells, they also affect other fast-growing normal cells, leading to a range of side effects. How does chemotherapy work? Chemotherapy functions through several mechanisms to combat cancer cells. Cell cycle interference. Many chemotherapy drugs work by interfering with the cell cycle, the process by which cells grow and divide. By disrupting this cycle, these drugs can prevent cancer cells from multiplying. Some drugs target specific phases of the cell cycle, such as mitosis or DNA synthesis. DNA damage. Some chemotherapy agents cause direct damage to the DNA of cancer cells. This damage leads to errors during cell replication, triggering cell death. Examples include alkylating agents, which add alkyl groups to DNA, thereby preventing proper replication and function. Inhibition of cellular functions. Other drugs inhibit specific cellular functions necessary for cancer cell survival. For instance, antimetabolites mimic substances needed for DNA synthesis, thereby disrupting the production of DNA and leading to cell death. Targeted therapy. Recent advances have led to the development of targeted chemotherapy agents that specifically target molecular pathways involved in cancer growth. Unlike traditional chemotherapy, which affects all rapidly dividing cells, targeted therapies are designed to affect only those cells with particular genetic or molecular abnormalities. Types of chemotherapy. Chemotherapy can be categorized into several types based on their mechanism of action, administration routes, and specific drugs used. Alkylating agents. These drugs add alkyl groups to DNA, causing cross-links that prevent DNA replication. Examples include cyclophosphamide and cisplatin. Antimetabolites. These mimic substances necessary for DNA synthesis. Drugs like methotrexate and 5-fluorouracil fall into this category. Plant alkaloids, derived from plants, these drugs interfere with cell division. Paclitaxel and vincristine are examples. Antitumor antibiotics. These are not antibiotics in the traditional sense but are used to treat cancer. They work by intercalating DNA, preventing replication. Doxorubicin is a common example. Hormonal agents. Some cancers are hormone dependent. Drugs like tamoxifen block hormone receptors to slow or stop the growth of these cancers. Targeted therapies. These include drugs that target specific molecules involved in cancer progression. Examples include imatinib for chronic myeloid leukemia and trastuzumab for HER2-positive breast cancer. Administration of chemotherapy. Chemotherapy can be administered in various ways, depending on the type of cancer and the specific drug regimen. Intravenous for, the most common method, where drugs are injected directly into the bloodstream. This allows for rapid and widespread distribution. Oral. Some chemotherapy drugs are available in pill or capsule form, allowing patients to take them by mouth. Injection. Certain drugs can be injected into a muscle or under the skin. Topical. Creams or ointments containing chemotherapy drugs may be applied directly to the skin. Intrathecal. For cancers affecting the central nervous system, Drugs may be injected into the cerebrospinal fluid. Side effects of chemotherapy. Chemotherapy is effective but not without side effects. These arise because chemotherapy drugs also target rapidly dividing normal cells, such as those in the bone marrow, gastrointestinal tract, and hair follicles. Common side effects include nausea and vomiting, one of the most frequent side effects, often managed with anti-nausea medications. Fatigue. Patients may feel unusually tired or weak due to the impact on bone marrow and overall health. Hair loss. Chemotherapy drugs can cause hair loss, which is usually temporary. Increased risk of infection. Reduced white blood cell counts can make patients more susceptible to infections. Anemia. Lower red blood cell counts can result in anemia, leading to fatigue and weakness. Mouth sores. Sores or ulcers in the mouth and throat can occur, making eating and swallowing difficult. Changes in appetite. Patients may experience changes in taste and appetite, affecting their nutrition. Diarrhea or constipation. Chemotherapy can affect the gastrointestinal tract, leading to digestive issues. Long-term effects. Some patients may experience long-term or delayed side effects, including fertility issues or an increased risk of secondary cancers. Success rate of chemotherapy. The success rate of chemotherapy varies widely based on several factors. Type of cancer. Different cancers respond differently to chemotherapy. For example, cancers like testicular cancer and Hodgkin lymphoma have high cure rates with chemotherapy, while others, such as pancreatic cancer, may have lower success rates. Stage of cancer. Success rates are generally higher for cancers detected at an early stage. Advanced cancers may be harder to treat, though chemotherapy can still be effective in controlling growth and improving quality of life. Individual response. Each patient's response to chemotherapy can vary due to genetic and health differences. Some patients may experience significant tumor shrinkage, while others may have limited response. Combination therapy. Chemotherapy is often used in combination with other treatments, such as surgery or radiation. The overall success rate may be higher when chemotherapy is part of a multimodal treatment plan. Advancements in medicine. Newer chemotherapy drugs and targeted therapies have improved outcomes for many patients. Research continues to refine treatment protocols and minimize side effects. Statistical success rates. Statistical success rates can provide a general picture but may not always reflect individual outcomes. For instance, testicular cancer. The cure rate for advanced testicular cancer can exceed 90% with chemotherapy. Hodgkin lymphoma. Cure rates are also high, often around 80–90%, with appropriate chemotherapy regimens. Breast cancer. For some subtypes, particularly those with hormone receptors, chemotherapy combined with hormone therapy can lead to significant improvement. Survival rates vary, but many patients achieve long-term remission. Pancreatic cancer. This cancer has a lower success rate, with a 5-year survival rate around 10%, though chemotherapy can still play a role in extending survival and improving quality of life. Conclusion. Chemotherapy remains a fundamental component of cancer treatment, offering significant benefits in managing and curing various cancers. While its success rate can vary widely depending on the type and stage of cancer, as well as individual patient factors, advancements in chemotherapy and supportive care continue to improve outcomes and reduce side effects. Understanding chemotherapy's mechanisms, potential benefits, and limitations is crucial for patients and their families as they navigate cancer treatment. As research advances, the future holds promise for even more effective and targeted therapies, further enhancing the success rates and quality of life for cancer patients.